Genes or lifestyle, which is more riskier? Let's answer that today. I'm Dr. Bhuvan, I'm a breast medical oncologist at Max Gurugram. Today we're going to be talking about the genetic factor which lead to increased breast cancers and how do the lifestyle factors play into that. So what we need to understand is that in our studies which we did in our institute, what we found is almost 7 to 8% of the young breast cancer patients have those genes which predispose them to a higher risk of breast cancer. So, the vast majority of 93% of these females do not carry these genes. So, if you ask me whether the genes are the only risk factors, I think the answer is absolutely no. 93% of the breast cancer patients which we have in our institutes, they have no such genes which predispose them to higher risk. However, those females who do carry these genes, do the lifestyle factors play into them also? The answer is absolutely yes. First of all, they are the minority 7%. So, if you have 100 breast cancer patients, only 7 of those patients have those genes. But in those 7 patients also, early menarche, that's early onset of periods, a late menopause, a nulliparous state, that means a state of bearing no children, no lactation, obesity, drinking, all of these factors, they play into increasing the risk over the baseline risk. So I'll rephrase it. If you are one of those 7% of the patient population who do carry these genes, in which you have a higher risk, the lifestyle factors add over and above this. And this is very important. So if I have to give out a public message or a public education message, my first would be genes are not the most important factor. However, it may be the most commonly asked question in our clinics that, Dr. Chugh, why is it? Do I have those genes? Well, 93% chance you do not. It's your lifestyle which is predisposing you to develop this cancer. So, that's the first step of primary prevention. When you take care of those lifestyle factors, you're already reducing your risk. The second is early detection, which we can talk about sometime later. But if you are on those 7% who have those genes, or if you are one of those patients who have had getting the tested done and have found these genes, it's important that you still control your lifestyle factors. And the lifestyle factors are regular exercise, no obesity, avoid red meat, no alcohol. I'm nobody to advise, but having children does reduces the risk factors for developing breast cancer, and a lactation, that is breastfeeding, anything more than 6 months is used advisably. Thank you.